to use care response without using the email functionality. So just so you can get patients to complete the questionnaires on paper and then enter them into the system manually. So first of all, we want to go and add a view of patient. We're going to imagine we're creating a new patient here. Let's create Jane Smith as a patient, give her a date of birth. You need to do that in order for the system to allow you to create the patient. You've either got to put the patient's email address in, or you've got to complete these two address fields. If you don't put an email address in, then there's no way that Care Response can actually send an email to the patient. And you don't need to put good text in here. You can put any old rubbish text in these fields if you want to. So, High Street. I select which practice the patient is going to attend by default, and I create the patient. Do I want to have a telephone number for that patient? No, I don't. The reason we might want to do that is there's a function in Care Response to actually send messages out by SMS. So if you have a patient's phone number captured, you're prepared to use that. But for data protection reasons, if you're not going to use it straight away, you might decide you don't want to do it. Do you want to save? Yes. So create the patient. We now want to create the presentation. So which practice are they going to? Basingstoke. Which practitioner are they going to see? They're going to see me. I'm going to create the first appointment. So when are they coming in? They're coming in on Friday of next week, and they're going to see Jonathan Field as a practitioner. Get there. And Care Response has now generated the form, and the options we've got here is either to close this window and to close the window and go back to the work list, or to actually view the presentation now. If the patient has already completed the assessment questionnaire, I can now come in here and I can now complete the questionnaire and submit it. I'll show you in a moment how to enter it at a later time. It says here, set the completion date. That means if the patient completed the questionnaire 2 or 3 days ago, I can actually put in the date when they actually completed it. So I'm going to say that it's not going to do it, and the reason it's doing that is because I haven't entered the fields, and it's to check with the fields. But I'm going to come straight out of that, and if I go back into the patient, so we've now created the patient, created the date for the first visit, and we've created the initial assessment, but the patient hasn't completed it, and the system isn't going to email it. If I come back and I look at the patient, and then I go into the presentation. This is the information about the presentation, and at the bottom here we've got the assessment section, and this is the initial assessment that's been created. It hasn't been completed. If I click on this green arrow here, I can now complete that assessment. Just run through and complete it the normal way and click save. I'm not going to complete it now. And interesting, it's giving me the option to email it to the patient, but Care Response won't be able to email it to the patient. So we click that because it hasn't got an email address for the patient. So I found a bug, so I need to report that. I wasn't aware of that until now. So let's assume the patient's completed their initial assessment and they've completed a follow-up. We want to enter that into the system, and we're looking to do the Bournmouth Questionnaire, a follow-up assessment. So I click on here, I choose the assessment I want, and for the Bournmouth Questionnaire I want to go into the dynamic PROM outcome. Outcome for dynamic PROM, and that's because Bournmouth Questionnaire has been set as the default for this organisation. You can ignore all of the other ones. I click create selected assessment and it opens it, and I can complete that now. If I go back into the presentation without completing it, you see it's set up here, and I can come and click on that at any point in time and open it. For completing the patient's 30-day assessment, or an outcome assessment which has a satisfaction questionnaire built into it, we want to go into dynamic PROM outcome satisfaction. I'm not seeing there. satisfaction. It's early. Yeah. So I would select that one. I create it, and there's the assessment questionnaire. So it's the same as all the other ones, except it includes the patient satisfaction questionnaire as well. So that's how you'd enter and complete the assessment questionnaires without the patient having to do it by email.